Welcome back to Wave Listens Live. Joining me now is Dr. Regan Ackerman, Freedom Mini Dental Implants. And again, it is good to have you here on Listens Live.
Always a pleasure to be here.
We talk about the mini implants, the differences that makes from maybe a more traditional, larger diameter, maybe surgical option. So many different, I guess, cons to that people are trying to navigate and mitigate and find ways that they can find something that's more suitable for them. For you, when somebody comes to you, you have so many options to try to get somebody's smile back, no matter what condition your teeth are in, no matter how far along you are in dealing with periodontal disease, for example. Those options are there, and you're able to do it because of the certain type of procedure that you do.
Correct. Yes. There's so many different ways that I use the mini dental implants. You know, like you said, there's various stages people are in with their teeth. They maybe, you know, just need one tooth replaced or two teeth, or they may already have dentures and they're struggling with them, and I can do a snap-in denture with the mini implants, or we can do permanent teeth. So whatever stage you may be in, if you think you need implants, or maybe you were told you weren't a candidate for the surgical implants, or you couldn't afford the surgical implants, please call. We do a free consultation. It includes a 3D x-ray, and we're a small office. I'm the only dentist there. My husband is my assistant, so you're not going to get lost in the shuffle at our office. So please call for a consultation. But the mini dental implant is just a smaller diameter implant, so it's a lot less invasive. I don't have to do sedation. I don't have to put you to sleep. I don't have to do any incisions. A lot of times I don't even have to take people off blood thinners. So it's just a very minimally invasive way of doing dental implants.
And how are you able to do that? How are you able to avoid the incisions, having to actually cut through the gum, and actually end up using less bone too?
So I'll show you this model because I think it speaks volumes. So when I place an implant, I'm going to cover, I do not have to make this big hole, so versus like the surgical ones. I don't make an incision, so I'm going to cover that up because that is not what I do. I will numb you up, just local anesthetic. A lot of people just know it as generically as Novocaine. And then the little hole right there, that's the little pilot hole I make. So I don't have to make an incision or a stitch. I'm essentially making this little pilot hole through the gum into the bone. And then my implant, it's a much smaller diameter, and it's all one piece. That's kind of an important aspect. It's not a two-piece implant, so there's not two different surgeries. It's a one-piece implant. And I think this speaks volumes to show that I just need some bone to place an implant. I don't need a lot of bone. And it also shows just how minimally invasive the mini implant is.
You have the different options that could cover maybe a full mouth or every tooth, but it's also important to note you don't need, if you don't need to replace, everything. You have the options. Maybe you've experienced some physical trauma that has really hurt just part of your mouth. You can do that.
Yes. So I do single teeth all the time. I've done several patients in their 80s, even their 90s. They're just missing a front tooth or a couple teeth, and they just want that tooth replaced. So with the mini implant, I can place the single implant. The day I put the implant in, you'll leave with the temporary, so you get rid of whatever flipper or partial you might have been wearing, and then you come back only 4 to 5 weeks later to get the permanent tooth that gets cemented on permanently. So you don't have to wait 3 to 6 months for your permanent tooth. And I can do, several teeth together, a bridge, these are 3 teeth together here. So place the mini dental implants, no incisions, no stitches, and then we get the bridge made, and that gets cemented on permanently onto those implants. So now a lot of people are missing molars and they just want to chew again. I'm able to help them.
Yeah, and I think the fact that you can put them on and then not have to worry about them beyond brushing them like you would your normal teeth is a big part of that. And you can see at the end the results, generally speak for themselves. People are smiling and they feel comfortable smiling again. And I want to take a look at what some of those look like.
Booster. Yes. So he, was struggling with teeth, had some periodontal disease, had to have all his teeth removed. And he was definitely one of my patients that he was like, I have struggled with my teeth all my life, and now that I'm going to get this smile, I want them to be nice and bright and white. So he went with the nice bright white smile, has that confidence now. He has the permanent teeth that we'll probably show later, so he does not take anything in and out. There is nothing on the roof of his mouth. He gets to taste all of his food. He doesn't have dentures, and we were able to do that with the mini dental implant.
Show me the permanent one, what that looks like.
Yeah, certainly. So place the mini implants the same way, no incisions, no stitches. Gonna place the implants, and then I'm able to make what we call a roundhouse bridge of teeth. And this material, it's zirconia, so it's much stronger than a denture, which is why it can be trimmed back so much. And then when we place this with the mini implants, it stays in permanently. The patient, you do not have to take it out every day. You're gonna brush it just like regular teeth, toothbrush and toothpaste. We give you a water pick to help keep it clean, but then you have nothing on the roof of your mouth and you get to taste all of your food again. And you don't have the bulkiness of a denture at all. And I love this option that we've started doing too, because you'll come back to me every 6 months. I will be the one to remove it, and it's very easy for me to remove. It's not a big procedure, kind of like sometimes with the all-on-4s where they have to drill holes back in your mouth to take it out. So I love the cleansability and retrievability of this, and you'll see me every 6 months, but you do not have to take it out every day.
So we got like 30 seconds or so left here.
Yep.
I always got one more before and after.
Okay.
Look at this one, tell me who this is, and then walk me through the process of what you need to do if you want to do the same thing.
Okay, so this is Ron, and he had to have his teeth removed, and he had cleft lip and cleft palate, and so he did not have a lot of bone. But I was able to place the mini dental implants because I don't have to have a ton of bone, and we were able to do the permanent teeth, what I just showed you. So he doesn't have dentures. He's able to smile and eat again. And if you want to do what he did, please call our office and schedule a consultation. It's a free consultation. You'll see me. I'm the only dentist there. I'll go over, recommendations, treatment options, cost, any financing. We'll go over everything, and it includes a 3D X-ray. So please call for a free
freedomimplants.com. Call the number on the screen as well. So many options, Dr. Ackerman. Thank you. We got more Listens Live when we come back from the break.